Well, one of the things that it's important to know about the 3-minute breathing space is that we introduce it in the third and fourth sessions of the program. So they come to it already having experienced some of the longer, 40-minute body scan, 40-minute mindfulness of the breath. And because it's embedded in those programs, they can see it as a sort of detaching from the longer sit and not a freestanding practice on its own. I think the danger with offering this from the get-go is that people would just see it as a quick fix. Mm-hmm. I close my eyes, focus on my breathing, open my eyes, the world's a rosy place. Uh-huh. But actually taking it and understanding that within the 3-minute breathing space, there is the capacity to engage this other mode of simply holding and watching is something that you learn in the first couple of weeks of the program. And from that, we encourage people to practice it 2 or 3 times a day. Either at times that are kind of randomly, just set your watch for 7:30 at night, do a 3-minute breathing space, or at times that have to do with the appearance of stress in your life. And before you do anything, take a 3-minute breathing space and see what happens. So kind of planned versus unplanned. And then it becomes part of a repertoire. And I think actually there is a bit of a shift in some of the mindfulness/psychotherapy world where before, or at least I can say there's a shift in me. I used to be very attached to the idea that, if people are practicing, they should be practicing 40 minutes a day, like hardcore boot camp. And there are people who do that maybe on the weekends, and they don't do anything during the week. Mm-hmm. Now, I'm more convinced that if you can get people to do something every day, even if it's briefer, there's a chance that that'll actually stick. And it may be more conducive to looking after themselves on an ongoing basis. So my mind has sort of changed on that a little bit.